In 1981, after 3 years of service, the volunteer-run Chase Brexton Healthcare first heard about a mysterious illness in the gay community. Until then, the tiny clinic, open 2 nights a week, focused mainly on sexually transmitted infections. The Centers for Disease Control and Prevention initially thought the disease was a type of cancer attacking gay men, and they named the disease Gay-Related Immune Deficiency, or GRID. That name and the constant referral to AIDS being a homosexual disease created a lasting stigma for the gay community.
Like many young gay physicians at that time, were in a place and time where all of a sudden there was this problem and you take care of it. And we did not, in general, get a lot of good support from our colleagues in the general medical community. They didn't want to be involved. They didn't want to see our patients when we needed, consults if they knew it was a patient with AIDS.
In 1984, at the National Cancer Institute in Maryland, Dr. Robert Gallo co-discovered the virus that caused AIDS, human immunodeficiency virus, or HIV. This was a massive discovery, but it did not make HIV and AIDS any less terrifying. Fear of the disease led to the creation of restrictions and bans that would last for decades, and struck healthcare providers particularly hard.
I went through a very difficult soul-searching period to say, can I stay in this line of work? Because I have to make a decision. I can't be frightened and do it at the same time. So either I have to get over it or I have to change my line of work.
Branson, of course, continued to do the work. He went on to found HERO, an internationally renowned, multifaceted HIV and AIDS service organization in the heart of Mount Vernon in Baltimore. In the late 1980s, Robert Mell founded Baltimore's Movable Feast, a free food delivery service to provide healthy, homemade hot meals for the community's homebound AIDS patients. In 1987, when John Steuben moved from New York to Baltimore, he helped found the Baltimore arm of AIDS Coalition to Unleash Power, or ACT UP, a national civil disobedience network. With Steuben leading the way, activists protested at Baltimore Mayor Kurt Schmoke's home, chained themselves to Baltimore City Health Department's doors, and delivered coffins to City Hall in an effort to bring attention and money for HIV and AIDS research and treatment. His actions helped bring change, and before his death from AIDS-related illness in 1994, Steuben would serve on AIDS advisory committees and the HIV Planning Council for the mayor and the Baltimore City Health Department. Upon Steuben's death, Mayor Schmoke noted, "Through his presence and perseverance, he brought to our attention one of the most critical issues confronting us in Baltimore today. His death is a real loss for the community. His was a powerful voice." In that first decade, making patients comfortable, making them feel safe, was mainly all that could be done. Dr. Carla Alexander said, "It was much more like being in a war. Only the war wasn't acceptable to anybody because all of the people who were coming to the clinic were being blamed for the disease."
There was huge stigma, far more than now, about HIV, and we were, in many cases, the only people that knew they were positive. They just needed to have an ear. They needed to have a hug every once in a while and those things. There wasn't a staff member here who wasn't willing to do any and all of that.
Worse than the stigma, death loomed. During the first decade or so, 90% of those with HIV would die from AIDS-related illnesses. Monthly memorials were held for Chase Brexton's staff. And in 1995, Chase Brexton created Maryland's only AIDS memorial, the Wall of Courage. Chase Brexton participated in multiple national clinical trials, and AIDS Action Baltimore, founded by attorney and activist Linda D., took on the battle with pharma for development and access to desperately needed medications.
My thing was drugs, was drugs for treatment and prevention, and that's what AIDS Action has really been about, drug development, affordable access thereafter.
By 1997, hope began to emerge in the form of a cocktail of drugs called highly active antiretroviral therapy, HAART.
We had drugs, and I'll tell you, the first thing, our patients stopped dying. We didn't go to funerals. We used to go to funerals those first couple of years.
At the turn of the century, we slowly began to see that the advances in treatment were helping HIV to become a chronic, more manageable disease. The approval of rapid HIV testing allowed providers to get patients into HIV care more quickly. And as the decades wore on, slight changes to the bans created in the 1980s were finally occurring. Today, while we still struggle with stigma and misinformation, much has improved. Treatment is simpler and more effective. Prevention options have been expanded. In 2012, Truvada, an HIV treatment, became the first medication approved by the FDA as a pre-exposure prophylaxis, PrEP. Those without HIV could take PrEP once a day to prevent HIV infection. In 2019, multiple global health organizations, including the CDC and the World Health Organization, finally promoted U equals U. Undetectable equals untransmittable. Treatment that successfully suppresses HIV is a form of prevention. Those with virally suppressed HIV cannot pass HIV through sex. At Chase Brexton, we have added a third new testing van to help make HIV testing easier for those who are hesitant to get tested. And most importantly, to ensure patients receive their medications to stay undetectable and live healthier, longer lives, we are increasing our free, confidential prescription delivery service. As the painting renowned artist Tom Miller, dedicated to Chase Brexton in 1998, portrays, hope lives here. Hope lives today for an end to HIV.